Hi everyone, it's Megan. This week's topic is a how-to instructional video, and I will be discussing the benefits of stretching and how to perform some of these stretches. Stretching is used by many athletes and physical therapists and occupational therapists for many different reasons, and some of these benefits include, but are not restricted to, injury prevention, athletic performance improvement, healing. It also increases blood flow, flexibility, and your range of motion. Now I have a friend here who is going to help me demonstrate how to do some of these stretches. She will be demonstrating a few stretches that help with injury prevention and improvement of flexibility. First one she's going to start out with is a lunge. And what you do is you put one foot in front of the other, bend at the knee. It's very important to keep that back leg straight like she is. You also want to keep your back straight, shoulders back, facing forward, and you want to breathe through the stretches. Sometimes you can lean even more in, or some people will kind of bounce up and down almost and do it over and over again and switch to the other side. It's very important to keep everything in alignment and breathe through to prevent from causing injury or pain. And another stretch that she can do is stretch her hamstrings, which is used by many athletes to keep their legs stretched out. And also, I keep forgetting, I meant to mention that it is very important to warm up before stretching. You want to stretch out warm muscles. You don't want to go straight into stretching because you can actually hurt yourself. And also another stretch that you can do is lotus. You sit down on the floor and you put your feet together. It's okay that your knees are up. You actually want them to be up a little because otherwise you're going to hurt yourself. And you lean in, you hold your feet and you lean in. Again, it's very important to remember to breathe and keep that back straight. You just want to, if you need to, focus on your breathing. And you can do this for 10 or 20 seconds, sometimes even longer if you feel comfortable. Just, you don't want to push yourself or overexert yourself because you will hurt yourself. And then that's enough for the flexibility for now. Thank you, Amanda. Now, also, physical therapists use stretching as a huge part of their treatment. I know from firsthand because I know I mentioned in a previous video before that I did have shoulder surgery. The doctor had to cut my bicep tendon and reroute it because it was pinched in a groove. And then when I started physical therapy, one of the first stretches my therapist had me do was I would place my hand on a table or a counter. I'm just going to use the chair for the sake of the video. I put one foot forward and one back, almost like I would be lunging, but not quite. I lean forward, keep my back as straight as possible, and let my arm hang. Now, you don't want to move it in circles on its own. You want to hold it there and just let it kind of dangle, and you want to use the rest of your body to make it turn in circles. It's called a pendulum stretch. And my therapist would have me do this several times before moving on to any other stretches. Another one that my physical therapist would do is I would sit next to a table. Now I'm using the table to prop up my laptop, so I don't have it to show you, but I would put a towel under my hand because I literally, first starting out, could only move it very little. And eventually, after some time and practice and stretching without overdoing it, because again, I could hurt myself, I was still in the healing process, but eventually I got my range of motion back. Now I need Amanda for this one. Also in physical therapy, it would be an inward rotation where you keep your shoulder, not, you keep it kind of tucked in, but you don't want to jam it into your side. Keep it at a 90-degree angle and pull inward. And he would have me do this about 5 to 10 times, sometimes more. The more advanced I got into therapy, the more he would have me do this. And then also, we'll do it from the other side, moving in the opposite direction. Again, same idea. You want to keep your elbow tucked in, 90-degree angle, but you also want to keep your arm out straight. You don't want to start out here. You want to start out from right here, and you pull away. And again, he would have me do this several times until eventually I didn't have to do it anymore. Also, physical therapy helps a lot of people with sciatic nerve problems, which I will have Amanda demonstrate this one to you. So she's going to sit in the chair, 1 foot flat on the floor, and she's going to lift one leg straight out. She's going to have her toes point towards your face and out and towards your face again. Again, she wants to be sitting up straight, facing forward, shoulders back. She wants to breathe. She's going to do this several times over before relaxing and performing it again. This helps to alleviate any pressure that is on your sciatic nerve. There are several other stretches that you can do for sciatic nerve. This is one of them. I'm not sure what it's called. I'm terrible with remembering names of things. But sometimes some of the stretches will hurt your lower back a little bit, but the end result, it helps relieve some of the pressure on that nerve. And from personal experience, that has helped me tremendously. The back pain is worth it because the back pain is only temporary for whatever amount of time that I am performing the stretch. And then once I stop, back pain goes away and my sciatic nerve pain is gone away. Thank you, Amanda. Now, in conclusion, there are many benefits of stretching, and it is used by many people, not only athletes or physical therapists, but just everyday people who are exercising, trying to become healthy again, or healthier, or just to maintain their health. It is very important to make sure you hold your core. You want to maintain your posture, keep your back straight, otherwise you can hurt yourself further. And that is my conclusion for today's topic. Thank you.